Hi, my name is Kelsey. I have completed my 335 clinical experiences, and I'm going to use this video to explain how I have met all of my clinical objectives. So objective number 1 was to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. For me, my personal experience about utilizing previous knowledge was in an FYE, which is a first year experience course that I took my freshman year. It was here that I was given a task to explain a color to my partner who had their eyes shut and was pretending to be blind, and you couldn't use any colors to explain that color. This was a very frustrating task for me. It's very easy to say, oh, well, it's pink, don't you know it's pink? But you can't use colors. So I think that right there has taught me so much that I was able to bring into this nursing program. Because, you can be frustrated with things sometimes, and you have to step back and you have to be able to explain things to your patients or to whomever. So I personally experienced this in my interprofessional experience. I was with a nurse practitioner who was trying to describe CHF to a patient who had the new diagnosis. And for us, me and the nurse practitioner who are used to doing this, it's a very simple task. Oh, well, it's CHF and this is what happens, and we understand that pathophysiology. But for someone who this is brand new to, it can be frustrating to explain those things, just like it's frustrating to explain a color to someone without being able to use any other colors. So I feel like I've learned a lot from my therapeutic communications and how to explain things to people to be able to pull on that previous knowledge to meet the goals of this clinical. I also want to refer to 309. When I was in 309, I learned about giving a bed bath and what direction to give the bed bath in and what part to cover and uncover and at what time do you brush the teeth in the bed bath. And I used all my knowledge about that to be able to educate the junior class on how to properly give a bed bath and explain what you're doing to the patient, and maintain the patient's dignity is like a big thing that I use those skills to be able to explain to the junior class. Number 2 is to apply basic principles of management to meet the challenge of an ever-changing healthcare environment. And I saw this in my nurse leadership experience. When I was with her, we met with every unit in the hospital to look at their staffing, look at the patient acuity, the number of the census of the number of patients they had, and we found that the ER was short-staffed, 1 nurse and 1 tech. So now it was our job as the nurse supervisor and me shadowing the nurse supervisor to go back and figure out where are we going to pull this patient from? How are we going to manage this? How are we going to cover the demand without taking away the needs of another department? I learned a lot of management skills right then and there with the nurse supervisor because we were able to look through the float pool and check the level of acuity of certain patients on certain units and pull together to be able to meet the needs of the ER. Also with the nurse supervisor, we were able to meet with all of the techs and manage, did you have a break yet? If not, who's going to cover for you? And she let me play a big role in figuring out who would be the cover, and then she would let me know if I was correct or incorrect and guide me. And I think this was such an awesome experience to learn how to really develop my management skills. Number 3 is to demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. I did this best at the Bethlehem Flu Clinic. The clinic was an indoor-outdoor clinic, and I had the job of a runner, so I had a radio in my ear and I had a walkie-talkie, and it was my job to communicate between the inside and the outside. So I had to look at how many syringes we had ready to go versus how many cars we had lined up with people looking to get flu vaccines, and I had to hop on the radio and say, okay, we're going to need about 4 vaccines within the next 10 minutes, and then we need 10 vaccines within the next 20 minutes. And my job, I think I had a very pivotal role in this whole situation because it was my job to keep the flow of everything going, to keep that open communication on the walkie-talkie and listen to what other people needed. And I think that really helped me learn about communication. In addition to the emailing that I did for this whole clinical experience, I always emailed my preceptors a week prior, asking if there was anything I could prepare on, letting them know that I would be coming, confirming the date and time with them. And I think that's a big task to be able to speak in a professional manner to people via email when situations come up and schedules change. And I think that I've really learned a lot from this clinical experience about that professional and effective communication in a work setting. Objective number 5 was to clinically evaluate and disseminate current research related to principles of leadership and the effects of the healthcare system. So I did this twice, once with my ethical scholarly paper. What I did here was I evaluated research on vaccinations and specifically parental refusal of vaccinations for their children. With this experience, what I got to learn was that I spent like about 4 weeks looking at research on why parents refuse vaccines. What's at the main forefront of it? How can we fix that? And I was able to gather all of that knowledge from the research that I've looked through and write a paper on this huge ethical dilemma that we experience in the healthcare field. Also, in a couple of days, we're having our post-conference, and it's at the post-conference that I plan to share research of my own interest about cardiac stent placements. I found a really good article from 2017 that looks at placing stents that are bare metal into the coronary arteries compared to placing stents that are metal, but they are infused with medications, and looking at long-term research over several amounts of years to see the effects of these stents versus medicated or not medicated. And it was found that the drug-eluting stents actually had a lower risk of thrombi forming and reclosure and stenosis within the 2-year mark, the 4-year mark. So that was another instance where I was able to use research throughout this course in order to be able to advance my knowledge and learn more about the field with vaccinations, with cardiac, which is where my heart is, and no pun intended, which is where my heart is in cardiac. I love cardiac there. I love cardiac. So I was able to really explore research, which I think was super cool, and to really see how research defines nursing and the healthcare field. So the clinical objective number 5 is to function as a competent patient advocate, nurse advocate, and change advocate. So here I want to bring up the political legislative day. I think I did a fantastic job of acting as patient advocates because I discussed House Bill 314, which was sponsored by Don Costa. I was able to actually speak hand in hand with one of his representatives about this House bill, which states that nurses should have an immediate revocation of their licensure if they're known to be using, possessing, or distributing opioids. And I was so passionate about this because part of being a patient advocate is giving the patients the care they deserve, and they deserve care from a nurse who is competent and coherent and is able to effectively care for them. So I and a couple of my peers were able to talk about how we supported House Bill 314, which I think was an awesome experience in being a patient advocate. Also, when I was at Patient Logistics, I saw a really cool patient advocate experience. A RN from Geisinger Hospital had called into the RN that I was sitting with a potential stroke alert, and they wanted a teleconference with one of the doctors. Well, it was discovered that the doctor said, no, this patient isn't qualified to come to our hospital to receive care. So we are not going to accept this patient into one of our beds at the hospital. And the nurse that I was with was very passionate that this patient needed to come. So she took it upon herself to be an advocate for that patient. And she contacted another doctor. And turns out the other doctor disagreed with the first doctor and said, this patient is a stroke alert. I did a teleconference with them and they do need to come. So really it was because of that RN being the advocate for the patient that this patient got the care they needed, which was super cool to see advocacy completely in action in the clinical setting. Number 6 is to formulate plans for continued personal leadership, growth, and development as an independent practitioner of nursing and contributing member of society. I think throughout all of my clinical experiences, I was always telling people how I wanted to continue pursuing my education, but what really spoke to me was my advanced practice experience when I was with this one nurse who got her nurse practitioner and her master's nursing education, and she really told me everything I needed to know. I told her I want to be a nurse practitioner, and quite frankly, I didn't know what it entailed to be a nurse practitioner. I just knew it was something out there that I wanted to be. She explained to me about how getting my master's in nursing education, because I would like to be a professor one day as well, can help guide me in my degree of getting my NP, and that some of the classes that I take for my master's nursing education will roll over and cover credits in my nurse practitioner degree so that I can focus more on my specialty when I'm ready to advance to my nurse practitioner. And I think she was a wealth of knowledge. I was so appreciative to have her. And I also spoke all throughout my time, specifically in my advanced practice section. I was speaking with other floor nurses, and I talked to them about how they study for the NCLEX. I think that that's huge when you talk about being a leader and pursuing your education, is getting that first step, which is passing the NCLEX. I got referrals for a bunch of different NCLEX books they told me to use, and different resources, and Khan Academy and Kaplan and UWorld and all of these really great resources, which I think is pivotal in me continuing my education as a nurse leader, and making sure that I'm getting the goals that I need to get and reaching where I need to be at the end of the day. So I think I've learned a lot throughout my whole experience with that. Objective number 7 was to recognize the role of a nurse in policy making related to care services at local, state, national, and global levels. So again, here I want to refer back to my patient logistics day. We had a speaker who taught us how to pretty much advocate for ourselves. Who better to understand the changes that need to be made in the nurse practice than a nurse themselves who's currently in practice. So I think I learned a lot of helpful tips on how to speak up and stand up for yourself. And if to see something, say something. When something's wrong in your practice, you have every right to take that to your local legislator and to use the ranks to your advantage in order to be able to get what you feel is needed, and change that you feel is not only desired but deserved and critical for the development of the healthcare field. I also want to reference PSNA, the Pennsylvania State Nurses Association. They came to us to speak to us about patient advocacy for one, but also advocacy for yourself. You took on the desire to be a nurse educator and to be a nurse leader, and to really change people's lives. And it's at the forefront of that is bettering your own life and making sure that you have all of your own needs met. So I plan to join the PSNA. I had such a great experience with them when I was learning more about, being an advocate on a state level. The PSNA actually has something called Contact Your Legislator, and it's a form that I spent a couple hours exploring on the PSNA page about how you can fill out information of your concerns or your dilemmas or your any type of concern that you have. You can fill out a page, and PSNA will actually set you up with your local legislator, and they can teach you how to, write emails and get in contact with your legislator. And all you have to do is fill out the form, and they propose an email for you on this Contact Your Legislator page, which I think is super cool. And as a nurse, I plan to utilize that in the future for things that I think need to be changed. Number 8 is to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. I saw a huge ethical dilemma unfold when I was with my advanced practice nurse, and I want to reference provision 3.5 of the ANA Code of Ethics, which states that when a nurse becomes aware of behaviors that can compromise the quality of patient care, they need to say something. And the nurse manager saw that their new orientee nurse was not progressing as though she should. She was not meeting proper requirements. When they would advance her from 4 to 5 to 6 patients, she was slacking on medications, and they saw that as potential harm towards the patient. So I got to sit in on the meeting where they decided to let her go and get rid of her contract with the hospital, that's a huge ethical dilemma. That's a new hire and you have faith in them, but they just didn't pull through. Another ethical dilemma was at the same day, we saw a tech overstepping her boundaries, changing the flow rate on an IV pole. And the tech happened to be the nurse manager's really good friend. And this tech has been warned of overstepping her boundaries and unethical behaviors and being extremely rude to her coworkers. In the past, she had been there for 32 years. So it was really hard for the nurse manager that I was shadowing to step up and make that tough decision to let her go. With ethics, she was in the focus between, this is my friend and I want her to have a job, to she's not meeting provision 1.5 of the ANA Code of Ethics, which directly states the support of an ethical environment, that everyone and all employees on a unit deserve to work in an ethical manner. So this was really, I think, the epitome of ethical dilemmas that can potentially occur in a setting like this. She used her legitimate power, which we researched in lecture. We did lectures on different types of power, and she used her legitimate power, which was her title as the nurse manager, to uphold that provision. Overall, I think that I have learned an abundance amount. I think I've met all of my objectives. I think I've superseded all of my objectives. Going into this, I was, thinking about what I was going to learn, and I think that my expectations were completely met and far beyond met. I feel like I've learned how to grow as a nurse. I feel like I've learned how to advocate for patients and manage my time and effectively communicate via email, in person, and it was an overall great experience, and I'm so happy that I got to be a part of this. So thank you for listening to how I met my clinical objectives in my Nursing 335 Leadership Clinical Rotation. Thank you.